There are a group of patients who are on medications who, from my experience here in the clinic, if they pay closer attention to their lifestyle, they wouldn't need meds at all. So, for example, one of the most common diagnoses in Canada today is a diagnosis of high blood pressure, or as we say in medicine, hypertension. I have totally, since my experience with plant-based nutrition and observing people eating better and observing people not eating better, I kind of have now totally rethought about high blood pressure. I see high blood pressure much the same as diabetes. I really believe majority of people with high blood pressure are suffering from a fat toxicity. That doesn't necessarily mean that they're obese themselves, but that intravascular fat is causing a significant resistance to blood flow, which is then resulting in a high elevated blood pressure. So I see, many 30 and 40-year-old young people on a number of blood pressure meds, often that are not to target, by the way, and are not lowering their blood pressure low enough, who I tell them about this and say that I can say with a very high degree of certainty that the majority of people on high blood pressure pills, they're there because their intake of fat, which is generally a marker for their intake of animal products. So when I convince them successfully to pay attention to this and get the fat intake down, many of these patients can go from 5 meds down to 2 meds or 4 meds down to no meds. So there is a group of people, and these are people again who don't have established vascular disease, so they haven't been imaged to show that they have any plaques in their arteries. They're not diabetic. They haven't had a previous cardiac event. So those are folks where you could potentially go in with proper coaching and encouragement, get them to change their diet and bring them from a bunch of meds to no meds and basically get rid of the medications. And that is important because, again, as a pharmacist, knowing more about prescription medications than most physicians do because of the training, but every physician quickly learns this too, is that every time you use a medication, there's a hopefully small but real risk of side effects. So for every 100 people we treat with prescription meds, there's maybe 3 or 4 people who we're going to harm inadvertently by the use of those meds. So therefore, it's not a matter of if some of your patients are going to have side effects, sometimes dangerous side effects from these medications. It's only a matter of when they will, because the more meds you write, statistically, that 3 or 4%, if you write a few thousand prescriptions, now you're into a dozen, 2 dozen people who may be seriously injured with meds. So does that mean you should never ever use a medication? No. Again, if somebody's dying with pneumonia and an antibiotic has a 1 in 100 chance of harming somebody, but a 99% chance of saving their life, then it's generally understood in this industry that you use that medication with the small chance that you could harm the patient, but by doing nothing, the bigger harm is the patient almost invariably may perish. So those are scenarios where when your back's against the wall, you have to make hopefully an informed decision, realizing the risks and benefits. The benefits of food is that unless you strangle on a piece of celery, there's basically no downside to plant-based nutrition. And yet there's a big upside in terms of measurable benefits on both symptoms, markers like cholesterol and blood pressure, and reduction in outcomes. So there's all this gain to be realized with no payment of side effect risk. That's why nutrition should always be your foundation. Get as far as you can with the best nutrition you can manage with somebody. And then as a last resort, use medications in the second phase to try and improve their situation. What's happened with our system, which I know is a cliche and everybody has heard it a million times, is that modern medicine tends to upstream as a first line use medications for every complaint. And that's a problem because inevitably then you're going to use a ton more medications and inevitably then harm a lot more patients than if you switched it around, focused on lifestyle first, coach the patient as much as you could, get as far as you can there with no side effect risk, no downside other than the investment of teaching people lifestyle. Get them as good as you can, and then as a last resort, use medications in much smaller dosages only when everything else has failed, and truly failed. Not like, have you stopped smoking, yes or no, or eaten better, yes or no, oh, okay, well then here's a medication. Truly, as a physician, give it a real honest effort to both deal with their practical challenges and maybe some of the emotional challenges that are holding them back from choosing better lifestyle. And that may take a number of months. And then once you've maximized that, only go to the medications as a last resort. I think if you practice medicine that way, you're going to inevitably harm a lot less patients by them having side effects from a lot of meds that really in the end could have been avoided.